Hello, good morning, everyone. Buenos dias. Welcome back to everyone who had joined us yesterday, and hello to people who are new to our annual meeting today. My name is Michele Caggana, and I, along with Dr. Joanne Bedurtha, are the co-project directors for NYMAC, the New York Mid-Atlantic Caribbean Regional Genetics Network. Our region includes members from the states and territories of Delaware, Maryland, New Jersey, New York, Pennsylvania, Puerto Rico, Virginia, U.S. Virgin Islands, and West Virginia. So I wanted to take this opportunity first off to welcome you to day 2 of our second annual virtual meeting. We have 400 people registered for the meeting, and we're so happy that all of you could join us. We're hoping we can provide you today with a combination of new content to enhance your knowledge regarding genetics, and especially a focus today on telehealth services. And we also hope to present information that you could use both in your professional and your personal lives regarding access to genetic services and how to engage your provider as a team member to make the most of your experience. We're going to explore today ways that providers can assist in service delivery, some tools that are out there, telehealth services, and some other things that hopefully will make you understand better how you can access genetic services. And most importantly, we thank all of our stakeholders who joined us today from across the region, and we hope we can learn from you. Sure, you can appreciate we have a full agenda, and I'm going to go over the format in a little while. But I encourage you to use the chat and share your experience, and also let us know anything that we can do to make the meeting better. So to start off today, we're going to do just a brief poll, and it's a simple question. The question is, did you attend the meeting yesterday? So say yes or a no question. So Erica, can you pull that up? Yep.
Yep, it's up there and the answers are flying in.
So
far, it's actually 100% yes, but there's still some answers. Oh, we got a few people who are new to us today.
Great.
And when the numbers slow down, I'll end the poll and share the results for everyone.
Okay.
All right, numbers are slowed down. There you go.
Oh, wow. So we have a couple new people, so welcome. And thanks to everybody else who came back. Also a good thing. All right, so I wanted to thank everyone again for coming back and for participating in the meeting today. First off, I wanted to introduce our advisory committee and our team, our NYMAC team. Our funders from the Health Resources and Services Administration and the National Coordinating Committee, who oversees all of the regional genetic networks. You'll see some of our team members are in italic on the slide, and a lot of this I mentioned yesterday, but I'm going to repeat for the new folks on the call. We are the NYMAC team. We have our trendy, nice new logo backgrounds. So if you need anything or have questions, you can specifically look for our names and reach out to us via the chat or email. In addition, this year we welcomed Puerto Rico and Virgin Islands to our region. In the years past, we had worked, at least in New York State, we had worked with both Puerto Rico and the Virgin Islands when we were members of what's called the GENES, which was part of the Council of Regional Networks, or we used to call ourselves CORN. But after a few years of Puerto Rico belonging and participating in the Southeast region, we've now been able to welcome them back to our region. So we're looking forward to interacting with everyone, and especially a welcome to our families and advocates, because I think it's really good to have a place for your voices to be heard, and also all of the resources that are available via our family members as well. You've already heard from Erica, but I wanted to introduce her and her team. They have partnered with NYMAC to really help us out with this meeting. Last year, as I mentioned yesterday, we did a lot of this meeting on the fly because we had to go virtual with not very much notice. And so they've been very valuable in helping us make this program interactive and fun and enjoyable for people. So they're handling the behind the scenes, and she went over a lot of the technical assistance. And we really want people to pay attention and participate in the chat as the day unfolds. And keep an eye on that, and please give us your comments. I also wanted to extend a very special thank you to our 2 interpreters. They were invaluable yesterday, and they're here back with us today. And some of our presenters talked very quickly, so it was great that they were able to help our Spanish speakers understand what was going on. So thank you very much. I wanted to go back and review day one just a little bit. First off, I think Fred probably got the most comments for his music selection, so everyone enjoyed that. And I think he did have some special requests for today. Yesterday, we started our day off with talks on how to make a genetic diagnosis from Dr. Kim, and then what the future might look like from Dr. Chung. We also heard about our new model this year is the teams-based approach to do area-specific projects that really kind of impact people locally in their region, because our region is so diverse. We have very urban, very rural areas, melting pots, and so we thought maybe we'd have a bigger impact by being able to have more localized projects in specific areas. And so from Virginia, we heard from Dana and Kristen. New York, we heard from Sharon and Randy. And then from DC, we heard from Barbara and Dr. Schur about progress on their projects. And stay tuned, next year, we'll be onboarding additional teams to spread throughout our region. We also had a presentation on the Family Center from Molly Martsky and Jeanette Mejias from SPAN NJ. And they described the resources that were available to parents who are raising children with special health care needs. I was struck by the number of resources that are available and the dedication of the family navigators in their programs, and was thinking about how NYMAC can ensure that providers continue to familiarize themselves with these organizations and then make them available to families whose children are newly diagnosed, to keep that link of all these resources that are available, so that maybe parents don't have to search as hard to find them, that the providers can actually link them together. So we welcome any ideas or input on how to better connect providers and families with these fantastic resources. Next, we heard from Lynn Perry and Kelly King about parents' expectations and wants beyond the diagnosis, and our bilingual providers met to discuss bilingual service delivery and challenges and solutions. And then lastly, we had a really good session on cultural dexterity and consideration for delivery of services to everyone from Maria Isabel Frankenberg. And then we wrapped up the day with some breakout rooms where people could kind of debrief on what they learned and what they wanted to hear from today. So what's in store for today? We're going to start off with two sort of lectures. First will be describe the changing landscape of telehealth. This has become obviously very important during the pandemic, and we'll introduce you to resources that are available, and then how telehealth can actually be adapted for telegenetics will be reviewed. The second talk will review how primary care and geneticists can create successful partnerships, and that's one of our goals with NYMAC for this cycle. After the break, we will learn about genetic service delivery in Puerto Rico and the US Virgin Islands with a panel presentation, and that will be followed by a session on barriers to care and cultural considerations when delivering genetic services. Again, at lunch, our exhibitors will be present, and someone will be manning the NYMAC room as well. And please take a few minutes just to visit the exhibitors. And then after that, we are hosting two concurrent workshops. One will focus on patient involvement in registries and how that activity can actually help improve outcomes and interpretation of genetic results. So Dr. Chung yesterday talked a lot about the variants of uncertain significance and how it's difficult to evaluate new genetic variants. And so this project that you'll hear about will help kind of answer some of those questions. The second will focus on tips for families for a successful telegenetics visit. So we encourage people to pick one of those workshops. And then after the PM break, we will have a session on how to plan a continuous quality improvement project with a specialist in that area. And then again, we will have some areas where people can go to debrief at the end of the day. So normally I start off a meeting when I'm there in person, directing people to the exits, the bathrooms, and where the refreshment tables are. So I don't think I have to do that this time. I think you all know where you need to go, and you probably have your coffee sitting there with you. As Erica mentioned, these open sessions are going to be recorded, but the breakout rooms will not be recorded. And we are going to make the recordings and slides available to everyone after the meeting. The other point is that we hope to be able to enable participants who couldn't join the sessions to receive CME for viewing after the event. But there's additional things that we have to do to make that possible. So we're hoping to be able to do that. And we'll let you know via email from the NYMAC address, but we have to do some things after the fact. So the next few slides, again, are just an overview of what's needed for the CEUs. And we just put this up so that anyone who missed it yesterday can get the information that they need. I'm not going to read through all of this, but suffice it to say, for the genetic counseling CEUs, you have to be logged into the webinar to get credit. You can't call in, and we have to be able to provide evidence that you attended, and you need to document your attendance by doing the evaluation that will be sent out to you after the meeting. And you also need to use your ID to complete the form. If you have any questions about this, there's instructions on our website. And if you have any other questions, you can email Alyssa. And then for the ACMG, we have a series of slides that we have to show you. So the disclaimer is here for the credit. And then the next 4 slides are just a list of the presenters that are participating in the two-day program. Their full bios are available, but these are just the listings. So I'll just click through here. We heard some of these folks yesterday, and then we're going to have some more today. We also have to show you who has financial disclosures from the program speakers. So the 2 that have disclosures are listed here at the top, and the rest of the faculty had nothing to disclose. And then likewise, we also have to tell you members of the planning committee and what their disclosures were. And I believe none of us had any disclosures. So the ACMG will be giving the credit for the CMEs, and we will if you participate in the entire live program, you can get up to 14 credits for this program. And in order to do that, people are pretty familiar who've done ACMG type credit before. You have to complete a post-meeting evaluation, and then you have to print out a certificate, and you'll get the credit for participating. And the learning objectives are shown on this slide. We're going to summarize well-curated resources on genetic topics and conditions for primary care providers to use throughout the referral process and in managing patients with genetic conditions. List opportunities for broader engagement of providers, families, and public health entities with family organizations, and also to identify opportunities for new collaborations between NYMAC and all of the organization stakeholders that are on this meeting today. So before we begin today's program, I wanted to share just a few thoughts. Again, thank you to Pat Bish and Alyssa Terry, who really took on the bulk of planning for this meeting today. Also, thank you to the Marks team, who really helped us get this put together and got us all sort of trained on how we can do this to make it as enjoyable for everyone as possible. And again, a special thanks to our interpreters. You'll be given an opportunity to complete a brief evaluation. It's a very short couple-minute evaluation, but the goal here is to give you a chance to give us some feedback. And the ultimate goal is to help make these meetings become even better each year. So you'll have an opportunity to do that, and we do hope you do fill those out for us. Again, visit our exhibitor booths, including the NYMAC room. Lou and I will be there today. So don't forget to do that. And also, please remember to use the chat function and post questions and provide input on your thoughts about the day. And lastly, check out our Facebook page. It's the title of the page is on there, and it's also clickable on a link from our website, which is nymacgenetics.org. As I mentioned, we have our new NYMAC logo, and we have an evolving website that we've totally revamped. We worked with a company to help us get it modernized, and we are continually adding new content to it. And so I hope you take an opportunity to look today and then look again in a week, in a month, and on, because we're going to be adding new materials to that. And with that, I think we're ready to kick off the sessions for day 2. So I'm going to pass it over to Alyssa to introduce our speakers for the first session on telehealth. So thanks again for coming, and I hope you have a great day.